FUE, Follicular Unit Extraction, and FUT, Follicular Unit Transplantation, are two of the most popular hair transplant techniques used to treat hair loss. Both techniques involve the transplantation of hair follicles from one area of the scalp, known as the donor area, to a bald or thinning area, known as the recipient area. However, there are some key differences between the two techniques that are important to consider when choosing the best option for you. FUE is a minimally invasive technique that involves the extraction of individual hair follicles from the donor area using a small punch tool. The extracted follicles are then transplanted into the recipient area, typically using a micro-injection technique. One of the main advantages of FUE is that it leaves no visible scarring, as the individual follicles are removed one by one. This makes it a good option for those with shorter hairstyles or those who want to wear their hair very short. FUT, on the other hand, involves the removal of a strip of skin from the donor area. The strip is then dissected under a microscope to extract the individual hair follicles, which are then transplanted into the recipient area. The main advantage of FUT is that it allows for the extraction of a large number of hair follicles in a single procedure, making it a more efficient option for those with more advanced hair loss. However, FUT does leave a linear scar on the scalp which may be visible if not healed properly or if you have short hair. Another difference between the two techniques is the recovery time. FUE is typically associated with a faster recovery time, as there is no need for sutures or a linear scar. Patients can usually return to work and normal activities within a few days after the procedure. FUT, on the other hand, typically requires a longer recovery time, as the linear scar needs to heal. It can take up to 2 weeks before patients can return to normal activities. The cost of the procedure is also different between FUE and FUT. FUE is generally more expensive as it is a more complex procedure. In addition, the cost per graft is higher with FUE because of the manual extraction of each follicle. FUT is less expensive, but as said before, it leaves a scar which may have an additional cost for scar removal. In conclusion, both FUE and FUT are effective hair transplant techniques that can help to restore hair growth in areas affected by hair loss. The choice between the two techniques will depend on your individual needs and goals. FUE is a good option for those who want minimal scarring and a faster recovery time, while FUT is a good option for those with more advanced hair loss and can tolerate a longer recovery time. It is important to consult with a qualified hair transplant surgeon to determine which technique is best for you.